nocturnal hemoglobinuria. It occurs due to the acquired mutation of PIGA gene, which is present on the X chromosome in the stem cells of bone marrow. So what is PIGA gene? PIGA gene, it is a phosphatidyl ionacetal glycan A. So because of these acquired mutations of the PIGA gene, there will be deficiency of GPI anchor protein. So what is GPI anchor protein? That is glycosyl phosphatidyl ionacetal protein. So what are the GPI anchor proteins? One, it is the membrane inhibitor of reactive lysis, which is CD59, and second, decay accelerating factor, which is CD55, and third, it is the CD8 binding protein. So what is this GPI anchor proteins? What these things will do? We will inhibit the complement inhibition on the surface of the blood cells. Because these are get deficient, there will be no complement inhibition on the surface of the blood cells. Therefore, there will be a lysis of the blood cells will happening. Lysis of the blood cells are seen. So what we see the in the clinical features, we see the triad in the PNH. So because of the lysis of the blood cells, all the cells RBC, WBC, and platelets will get reduced. So this will lead to the pancytopenia. Pancytopenia with hypercellular bone marrow is seen. Hypercellular bone marrow is seen. So because of this RBC lysis, that is of intravascular hemolysis, hemoglobinuria is seen. So because of hemoglobinuria, we see the cola colored urine is seen. Urine indicates the hemoglobinuria. And next, because of this complement system, there will be endothelial activation leading to the thrombosis. Thrombosis is seen here. And other clinical features are because of this neutropenia, there will be of recurrent infections. Recurrent infections are also seen. And it occurs, 25% of the cases it occurs during the night time, that is of nocturnal, because of this acidic pH. So what are the investigations we do? So investigations, first it is the Ham's test. Ham's test, it is the acidified serum lysis test. And second, it is the sucrose lysis test. Sucrose lysis test. And third, it is the decrease of the lab score. That is leukocyte alkaline phosphatase. And the gold standard one, and the gold standard test, it is the flow cytometry. The flow cytometry, we should demonstrate CD59 is negative and CD55 is negative. And the fifth one, we have to do the flare, that is, which is a newer test, fluorescein aerolysine test, which is the new test. And next, it is the treatment part. So main thing, there will be inhibition of we have to do the inhibition of the complement. So we have this pegcetacoplan, so which is a pegylated peptide, which is targeting C3, complement C3. Next, we have this eculizumab. Next, ravulizumab, which is a monoclonal antibodies. These are the monoclonal antibodies against the C5. These are not curative. And curative treatment is bone marrow transplantation.